with this, let me hand over back to General for the opening remarks. Dr. Tedros.
Thank you, Christian. Good morning, good afternoon, and good evening. Earlier this week, I was vaccinated against COVID-19. It was a bittersweet moment. On the one hand, vaccination is a triumph of science and global solidarity. Alongside public health measures, vaccination is key to controlling this pandemic, and I'm very grateful to the health workers at the Geneva University Hospital, Hague, for helping me play my part. However, my thoughts were very much with the health workers around the world who have been fighting this pandemic for more than a year. The fact that so many are still not protected is a sad reflection on the gross distortion, unfolding of a moral catastrophe. Unfortunately, we're now witnessing this play out. In a handful of rich countries, which both have the majority of the vaccine supply, lower risk groups are now being vaccinated. I understand why some countries want to vaccinate their children and adolescents, but right now, I urge them to reconsider and to instead donate vaccines to COVAX. Because in low and lower middle income countries, vaccine supply has not been enough to even immunize health and care workers, and hospitals are being inundated with people that need life-saving care urgently. At present, only 0.3% of vaccine supply is going to low-income countries. Trickle-down vaccination is not an effective strategy for fighting a deadly respiratory virus. India remains hugely concerning, with several states continuing to see a worrying number of cases, hospitalizations, and deaths. WHO is responding and has shipped thousands of oxygen concentrators, tents for mobile field hospitals, masks, and other medical supplies. And we thank all the stakeholders for supporting India. But it's not only India that has emergency needs. Nepal, Sri Lanka, Vietnam, Cambodia, Thailand, and Egypt are just some of the countries that are dealing with spikes in cases and hospitalizations. Some countries in the Americas still have high numbers of cases, and as a region, the Americas accounted for 40% of all COVID-19 deaths last week. There are also some spikes in some countries in Africa. These countries are in heightened response mode, and WHO will continue to provide support in all ways possible. COVID-19 has already cost more than 3.3 million lives, and we're on track for the second year of this pandemic to be far more deadly than the first. Saving lives and livelihoods with a combination of public health measures and vaccination, not one or the other, is the only way out of the pandemic. Vaccine supply remains a key challenge, but this week I have been pleased to see leaders and manufacturers working to address some of these issues. First, there have been a number of new country announcements about sharing vaccines with COVAX, which is the fastest way to ensure equitable rollout of vaccines. Second, new deals involving tech transfer and sharing of know-how between international manufacturers to scale up vaccine production has been announced. And third, Leaders, including the Prime Minister of Spain, Pedro, for all trade barriers to be lifted as soon as possible. Muchas gracias. As we welcome this momentum, WHO has again convened researchers and scientists from around the world to update the research and innovation roadmap to take stock of what we have learned and identify the most pressing knowledge gaps. From the outset of this pandemic, WHO's R&D blueprint for epidemics played a facilitating and coordinating role, convening expert networks to drive progress across a range of thematic areas and connecting key funders to focus on identified research priorities. In the past 18 months, major advances have been made in the understanding of modes of transmission, epidemiological trends, clinical management, development of point-of-care diagnostics, treatments, and a large number of vaccines. Social and behavioral scientists and ethics experts have also worked to ensure that research was up to the highest ethical standards. The research forum is being webcast live over 2 days, and I challenge them to deliver complete solutions that take the development, evaluation, and deployment of tools from their beginning to their end, prioritizing both equity and efficiency. I urge them to expand collaboration between expert groups and partners and utilize global research capacity that has not yet been sufficiently leveraged, particularly in lower income countries. And finally, I urge them to further promote large platform trials across the world. This is the fastest way to prove the efficacy of new diagnostics, treatments, and vaccines. It's amazing how far the world has come in less than 18 months. But I have high hopes that breakthrough innovation will continue at record pace. Yesterday, I announced the winners of the second WHO Health for All Film Festival, and I have been thinking since about the importance of telling stories to increase awareness, build solidarity, and foster positive change. I was struck by how each film winner creatively reflected new situations and different realities, highlighting challenges, but also a way through. Watching the news, sometimes it might seem that the world's problems are intractable, but I want you to know that WHO will keep fighting to defend the health rights of all people everywhere in the world. The one thing they had in common was that to beat the challenges of our time, we must bridge our divides and craft new stories together. This week, Muslim brothers and sisters have been celebrating Eid al-Fitr, and I want to end by wishing Eid Mubarak to everyone celebrating. Stay safe.